151. The vestibular nerve regulates eye movement during head rotation. True or false? Answer: true. Rationale: the vestibular nerve, part of cranial nerve 8, detects head movement and coordinates eye movement via the vestibulo-ocular reflex, critical for neurological balance assessments. 152. The motor cortex is located in the occipital lobe. True or false? Answer: false. Rationale: the motor cortex is in the frontal lobe, controlling voluntary movements, while the occipital lobe processes vision, a key distinction for neurological localization. 153. The vagus nerve innervates the heart to increase heart rate. True or false? Answer: false. Rationale: the vagus nerve, via parasympathetic fibers, slows heart rate, while the sympathetic nervous system increases it, critical for neurological autonomic regulation. 154. The basal ganglia modulate emotional responses. True or false? Answer: false. Rationale: the basal ganglia regulate motor control, while the limbic system, including the amygdala, modulates emotions, important for neurological function differentiation. 155. The optic nerve carries signals for the pupillary light reflex. True or false? Answer: true. Rationale: the optic nerve, cranial nerve 2, transmits visual input for the pupillary light reflex, with the oculomotor nerve mediating pupil constriction, key for neurological testing. 156. The parasympathetic nervous system dilates the bronchi. True or false? Answer: false. Rationale: the parasympathetic nervous system constricts bronchi, while the sympathetic system dilates them, a critical autonomic response in neurological respiratory regulation. 157. The cerebellum is responsible for language processing. True or false? Answer: false. Rationale: the cerebellum coordinates movement and balance, while language processing occurs in the frontal and temporal lobes, important for neurological cognitive assessments. 158. The hypoglossal nerve is responsible for facial expressions. True or false? Answer: false. Rationale: the hypoglossal nerve, cranial nerve 12, controls tongue movement, while the facial nerve governs facial expressions, critical for neurological cranial nerve exams. 159. The sodium-potassium pump generates action potentials. True or false? Answer: false. Rationale: the sodium-potassium pump maintains resting membrane potential, while action potentials result from ion channel activity, a key concept in neurological signal transmission. 160. The thalamus relays motor signals to the cerebellum. True or false? Answer: true. Rationale: the thalamus relays motor signals between the cortex and cerebellum, facilitating coordinated movement, essential for neurological motor pathway assessments. 161. The dura mater is directly attached to the brain tissue. True or false? Answer: false. Rationale: the dura mater is the outermost meningeal layer, separated from brain tissue by the arachnoid and pia mater, a key distinction for neurological infection diagnostics. 162. A stroke in the cerebellum can cause aphasia. True or false? Answer: false. Rationale: a cerebellar stroke causes coordination issues like ataxia, while aphasia results from cortical damage in the frontal or temporal lobes, critical for neurological localization. 163. The glossopharyngeal nerve innervates the parotid gland. True or false? Answer: true. Rationale: the glossopharyngeal nerve, cranial nerve 9, provides parasympathetic innervation to the parotid gland, stimulating salivation, key for neurological autonomic testing. 164. The corpus callosum regulates autonomic functions. True or false? Answer: false. Rationale: the corpus callosum connects cerebral hemispheres for cognitive integration, while autonomic functions are regulated by the brainstem and hypothalamus, important for neurological roles. 165. The dorsal column medial lemniscus pathway transmits pain signals. True or false? Answer: false. Rationale: the dorsal column medial lemniscus pathway carries vibration and proprioception, while the spinothalamic tract transmits pain, critical for neurological sensory exams. 166. the substantia nigra is located in the cerebellum. True or false? Answer: false. Rationale: the substantia nigra is in the midbrain, producing dopamine for motor control, while the cerebellum coordinates movement, key for neurological anatomy. 167. The trochlear nerve controls lateral eye movement. True or false? Answer: false. Rationale: the trochlear nerve, cranial nerve 4, controls downward eye movement, while the abducens nerve handles lateral movement, critical for neurological cranial nerve testing. 168. The sympathetic nervous system promotes insulin secretion. True or false? Answer: false. Rationale: the sympathetic nervous system inhibits insulin secretion, while the parasympathetic system promotes it, a key autonomic response in neurological metabolic regulation. 169. The internal capsule contains only motor fibers. True or false? Answer: false. Rationale: the internal capsule contains both motor and sensory fibers, including corticospinal and thalamocortical tracts, critical for neurological stroke assessments. 170. The hypothalamus is responsible for visual processing. True or false? Answer: false. Rationale: the hypothalamus regulates autonomic functions, while visual processing occurs in the occipital lobe, a key distinction for neurological function localization. 171. The facial nerve controls taste on the posterior third of the tongue. True or false? Answer: false. Rationale: the facial nerve, cranial nerve 7, controls taste on the anterior 2/3, while the glossopharyngeal nerve handles the posterior third, critical for neurological exams. 172. The cauda equina is responsible for upper limb reflexes. True or false? Answer: false. Rationale: the cauda equina contains lumbar and sacral nerve roots for lower limb function, while upper limb reflexes involve cervical roots, key for neurological reflex testing. 173. The reticular activating system is involved in memory consolidation. True or false? Answer: false. Rationale: the reticular activating system regulates alertness, while the hippocampus consolidates memory, a critical distinction for neurological cognitive assessments. 174. The optic chiasm is responsible for color vision. True or false? Answer: false. Rationale: the optic chiasm facilitates crossing of nasal visual fibers, while color vision is processed in the retina and visual cortex, important for neurological visual assessments. 175. The pons contains nuclei for cranial nerves V, 6, and 7. True or false? Answer: true. Rationale: the pons houses nuclei for the trigeminal, abducens, and facial nerves, controlling facial sensation and movement, critical for neurological cranial nerve exams. 176. The limbic system regulates posture and balance. True or false? Answer: false. Rationale: the limbic system modulates emotions and memory, while the cerebellum regulates posture and balance, key for neurological motor function differentiation. 177. The abducens nerve controls downward eye movement. True or false? Answer: false. Rationale: the abducens nerve, cranial nerve 6, controls lateral eye movement, while the trochlear nerve manages downward movement, critical for neurological assessments. 178. The sympathetic nervous system increases gastric motility. True or false? Answer: false. Rationale: the sympathetic nervous system inhibits gastric motility, while the parasympathetic system enhances it, a key autonomic function in neurological digestion. 179. The corticospinal tract terminates in the brainstem. True or false? Answer: false. Rationale: the corticospinal tract extends from the motor cortex to the spinal cord, controlling voluntary movements, critical for neurological motor pathway assessments. 180. The thalamus is responsible for speech production. True or false? Answer: false. Rationale: the thalamus relays sensory and motor signals, while speech production is handled by Broca's area in the frontal lobe, key for neurological language assessments. 181. The vagus nerve controls the sense of taste. True or false? Answer: false. Rationale: the vagus nerve, cranial nerve X, regulates visceral functions, while taste is mediated by the facial and glossopharyngeal nerves, important for neurological sensory exams. 182. The primary auditory cortex is located in the parietal lobe. True or false? Answer: false. Rationale: the primary auditory cortex is in the temporal lobe, processing sound, while the parietal lobe handles sensory integration, critical for neurological localization. 183. The choroid plexus absorbs cerebrospinal fluid. True or false? Answer: false. Rationale: the choroid plexus produces cerebrospinal fluid, which is absorbed by arachnoid villi, a key process for neurological intracranial pressure regulation. 184. The substantia nigra produces acetylcholine. True or false? Answer: false. Rationale: the substantia nigra produces dopamine, while acetylcholine is synthesized in other neurons, a critical distinction for neurological neurotransmitter roles. 185. The spinothalamic tract originates in the dorsal horn. True or false? Answer: true. Rationale: the spinothalamic tract originates in the dorsal horn, transmitting pain and temperature signals to the thalamus, essential for neurological sensory assessments. 186. The hypothalamus regulates voluntary muscle movements. True or false? Answer: false. Rationale: the hypothalamus controls autonomic functions, while voluntary movements are governed by the motor cortex, a key distinction for neurological motor control. 187. The facial nerve controls the platysma muscle. True or false? Answer: true. Rationale: the facial nerve, cranial nerve 7, innervates the platysma muscle, involved in neck and facial movements, critical for neurological cranial nerve testing. 188. The middle cerebral artery supplies the brainstem. True or false? Answer: false. Rationale: the middle cerebral artery supplies the lateral cortex, while the brainstem is supplied by basilar and vertebral arteries, key for neurological stroke localization. 189. The dorsal root ganglia contain motor neuron cell bodies. True or false? Answer: false. Rationale: dorsal root ganglia house sensory neuron cell bodies, while motor neuron cell bodies are in the ventral horn, critical for neurological reflex pathways. 190. The Broca's area is located in the temporal lobe. True or false? Answer: false. Rationale: Broca's area, responsible for speech production, is in the frontal lobe, while the temporal lobe handles comprehension, key for neurological language assessments. 191. The sympathetic nervous system promotes pupil constriction. True or false? Answer: false. Rationale: the sympathetic nervous system dilates pupils, while the parasympathetic system constricts them, a critical autonomic response in neurological pupil exams. 192. The corticobulbar tract controls swallowing movements. True or false? Answer: true. Rationale: the corticobulbar tract innervates cranial nerve nuclei for swallowing, critical for assessing neurological dysphagia in conditions like stroke. 193. The optic disc contains photoreceptors. True or false? Answer: false. Rationale: the optic disc, where the optic nerve exits, lacks photoreceptors, creating a blind spot, while photoreceptors are in the retina, key for neurological visual assessments. 194. The reticular formation regulates body temperature. True or false? Answer: false. Rationale: the reticular formation modulates alertness, while the hypothalamus regulates body temperature, a critical distinction for neurological autonomic functions. 195. The trochlear nerve controls pupil dilation. True or false? Answer: false. Rationale: the trochlear nerve, cranial nerve 4, controls eye movement, while pupil dilation is mediated by the sympathetic nervous system, critical for neurological exams. 196. The internal capsule is responsible for memory formation. True or false? Answer: false. Rationale: the internal capsule contains motor and sensory tracts, while memory formation occurs in the hippocampus, a key distinction for neurological cognitive functions. 197. The vagus nerve innervates the diaphragm. True or false? Answer: false. Rationale: the vagus nerve regulates visceral functions, while the phrenic nerve innervates the diaphragm, critical for neurological respiratory assessments. 198. The primary somatosensory cortex processes auditory signals. True or false? Answer: false. Rationale: the primary somatosensory cortex processes touch, while the auditory cortex in the temporal lobe handles sound, key for neurological sensory localization. 199. The parasympathetic nervous system promotes sweating. True or false? Answer: false. Rationale: the sympathetic nervous system promotes sweating, while the parasympathetic system regulates restful functions, a critical autonomic response in neurological regulation. 200. The thalamus relays pain signals to the cortex. True or false? Answer: true. Rationale: the thalamus relays pain signals via the spinothalamic tract to the somatosensory cortex, essential for assessing neurological sensory function.